I'm Lynn. I've got one child and I gave birth in November 2014 at home in London.
I am a mother of one. I gave birth in November 2014 to a little girl at UCLH in London.
I'm 31, mother of one.
I am 32 and I have two children, both boys.
When I went for my first appointment, I was asked if I'd thought about where I wanted to give birth, and when I said that I would like to consider a home birth, that was treated very positively, which was nice.
When my appointments began, I was just hoping to be informed, basically. I hoped they would answer my questions, with facts, and I feel like they did.
The full 9 months I was pregnant, I was so worried due to how bad my care had been prior to birth.
I did transfer hospital partway through my pregnancy as I moved house, and I had to go through the booking in procedure again, including getting blood tests done again, which was a bit frustrating, and I suppose it feels like a bit of a waste of resources.
The labour itself was amazing. I was the second C-section of the day. Me and my husband went onto the ward, we were gowned up. The midwife who was looking after us was so nice. She explained everything that would happen. She was friendly, helpful, literally couldn't have done any more for us.
It was a bit of a mess on the day I gave birth, because it was the day the midwives were on strike for the first time in 100 years, and they'd forgotten that I was coming in to be induced, so I wasn't on the list. They did leave me, but I was never worried, and something happened and the midwife came back within minutes, so I really had no problems with that. They were definitely friendly, and the midwife was in control, which was very good.
Being at home, there was at least one midwife, sometimes two, there with me the whole time, which was very reassuring. I had the two home birth midwives came back and checked that she was feeding well, and then also a breastfeeding support person from the health visitors team came to see me as well.
Because I had breastfed my eldest, I didn't feel that I needed the help, so I just said thank you, but I declined. So my midwife just came in, grabbed my breasts, grabbed baby's head and just kind of stuck them on and went, there you go, or something like that, checked something on my chart and then left, and I was just completely stunned.
My daughter was born with tongue tie, and it was not recognised at hospital, despite me going on and on and on about how she wanted to breastfeed for hours. Only one of them looked in her mouth in the middle of the night when she just wouldn't go back to sleep, and she looked without using a light, and she obviously wasn't trained and didn't notice tongue tie. So after that I was convinced, okay, she doesn't have tongue tie, I'm just breastfeeding wrong. A week later, a professional lactation consultant private came to my house, diagnosed tongue tie.
I tell people now, make sure you have someone with you literally every minute if you can.
Make sure you are happy, get all the information that you need, ask any questions, and if your midwife, if your doctor can't answer it, ask somebody else. There's always somebody more knowledgeable.